better to have slides where I'm talking for a vision. Well, as you may know, the WHO has a very ambitious program called Universal Health Coverage, UHC. And here you have the three main ideas which are driving this program. The one is to ensure continuum of care. This is extremely important. To ensure access of care and to ensure safety of care. All big ideas with which we are very familiar in the field of imaging, but imaging is completely missing and is not addressed, even not mentioned in this program. So today my goal is to see whether our experience with the BSS, this is European regulation, the basic safety standard, and our experience in Eurosafe imaging, our experience with the different contacts we have had in the past in different countries from Africa and the Middle East, how this experience could feed some program of imaging which could help the WHO plan to be successful. And what we learned, basically, we have 5 main points. The one is that the implementation of a justification process, this is the most challenging. Why? Because there is a lack of guideline use in Europe and beyond Europe. The point number 2 is that there is a gap between regulators and health decision makers, because radiation protection is under the responsibility of what we call competent authorities, which are dealing with nuclear power, nuclear waste, and so on. But we are completely disconnected from the healthcare activities. And this is an issue. The point number 3 is the increasing importance of equipment performance and optimization. I will show you that. The point number 4, there is a strong benefit of a full cooperation with radiographers and medical physicists. And this is what we are doing into Eurosafe, at least. And 5, that the communication capabilities of imaging are strong but are underused. First, the regulation background. What says the regulation? You have 2 kind of approach. In the US, they say, for example, you must use clinical decision support for imaging requests. You must use. And in Europe, we say we must have clinical guidelines. And in one hand, in America, the approach is mostly based by cost containment issues, while in Europe, this approach is under the umbrella of safety. So this is a completely different approach, and I think that it is important for everyone which would like to have a plan for imaging to consider which regulation we want to have, either safety, either cost, even both. But you have to be clear for that. There are very important drivers on the side of technology. Digitization, constant evolution. Our equipment, we are changing every 2 to 3 to 4 years, and we have a new generation which is coming very soon. And consequently, some complexity which is increasing. And we have to consider that from the beginning through education which should be seen in this context of complexity and of rapid changes, and education, I am saying education of the radiologists, of course, but also of the radiographers and of the medical physicists. There are some safety drivers, but as you will see, there are some limitations. We have some alert systems. They are not largely implemented, only a few. They are dose monitoring systems, they are not mandatory, at least in Europe. They are dose reduction software, but they are equipment age dependent. And artificial intelligence is extremely promising, but still under implemented. As regards the technology solution for safety, we have today 3 different ways. The one is the improvement of detectors, and for example, the coming of a new photon counting CT is very promising. As you can see here, one can expect a decrease of a dose at least 30 to 40%. The other one is, as you can see, an example here, artificial intelligence, in which you can convert low-dose images to virtual high-dose images, with consequently save of 80% of the dose, which is incredible. And here, for dose reduction software, you can decrease the dose by 50%. And here, the relation between the dose and the age of equipment, this is a study made in France. And you can see here, this is the age of equipment. And here with the old equipment, here recent equipment, you can save 30% of the dose when you are using recent equipment. So the main message is that optimization is strongly dependent of equipment performances, and maybe mostly during the past years. We have never seen that. We always insisted on good practices, which of course are very important, but today optimization is mostly based on equipment performances. And I think that equipment policy should consider the context of safety as a priority. Imaging has a very strong communication properties because we adopted very early standards like DICOM, IHE, HL7, and thanks to that, we have been able to develop PACS and teleradiology very, very largely. But, my opinion, we have not used these capabilities for developing registries and also for making some regional organizations, having some regional organization level. At least in Europe, I don't know in your country. And I think that we should consider these imaging communication properties as a full component for registries and for a regional organization of imaging services. There are some other safety challenges which are emerging, which are listed here. I just want to insist on non-ionizing imaging access. Why? Because for some patients, like children, pregnant women, or young people, they need to have an access to non-ionizing radiation. And this limited access means an increased exposure for this sensitive population. Just to show you an example, very interesting from Estonia, and they have over the year, this is here 27, and 2007 and 27, they have calculated the number of CT and MR for the children. And you can see here the significant decrease of CT and the significant increase of MRI. So I think this access to non-ionizing radiation, ultrasound, I must pronounce ultrasound in front of Hassan Garbi and Lorenzo Derki, otherwise they will be killed. But ultrasound and MRI are extremely important to consider, to be considered. So now at this point, what could be the key driving concepts of an imaging plan? You have here the updated, fully digitized equipment, which is, in my opinion, extremely important, with its counterpart of imaging communication properties. Safety policy with its counterpart of regulatory background, a multi-professional approach with a relevant education program for the three specialties, and finally, to set up a multi-alliance project integrating IT, physicians, and internal organizations. So now, given that, how to make a package, an exciting package, in order to be included in the WHO work plan. What are the most important idea of this WHO work plan? The one, I think, the ensure continuum of care. And it means for the WHO that there are three levels of organization. The one is primary care, secondary care, and tertiary care. And does imagine could be fit with this view? Certainly, because if we consider primary care, we could say, for example, that we could use the still existing primary care workforce. Could be nurses, things like that, and to provide to them some imaging equipment like portable ultrasound. And this view is supported by WFUM, and I'm very happy by that. The level number 2 could be secondary care with some more specific equipments. Could be X-rays, CT, and ultrasound, but with a dedicated workforce. Dedicated workforce because this workforce should be able to make not only images, but also to use some automatic detection system which will be developed with AI, and also to use the teleradiology services. So it's not radiographer like in Europe. In my opinion, it should be some radiographer having a specific orientation. And for the tertiary care, which I could set, it could be a center of reference, it could be either regional or national, with a full set of equipment and, of course, a full team of imaging. The other important point in the WHO project is a digital transformation of healthcare. And it is clear that imaging is ready to help and to use the digital transformation of healthcare. And for example here, we must have, by using the imaging connectivity, a full connection between these layers together. So we cannot imagine having only 3 static levels. Each of these levels, they should communicate between them. And last but not the least, the important aspect for WHO is to provide safe healthcare services. And for imaging, it means to adopt or to adapt still existing regulatory background. And for example, for us to fight misuse and overuse of imaging. In summary, shouldn't be naive, because there is a strong regional and country diversity, so we could not have a single approach, but we could have some basic model we could be adapted or adopted, and using 3 major principles: continuum, digitization, and safety. And we would like to invite you to ECR and to thank you for your attention.